Mōrena, te Aotearoa tuatahi tēnā koutou, me ki o koutou mihi mai oha ki a tātou ko whakaemi nei kei ro I tēnei te tāhu whare. I te kaupapa whakaharahara, me ki rākai pāka tēnei te mihi ki a koe John, me mō tō whakatau ki aua, me ngā kai kōrero o te wā, me ka tātou ngā kai mahi o tēnei te mana tū hauora kei wainga tātou tara nei. And it's good to see Hikurangi right here, Kia ora Agnes. And as you know, the first city in the world to see the sun, and which gives us a lot of inspiration. Nothing is impossible. When Maui fished up the Ikaroa, Ikanui, the whenua nui, and slowed down the sun so that we can actually have some time to mow the lawns, it was fantastic. So thank you for the opportunity to talk about equity. I didn't learn about equity when I was at school, and nor did I know what it was till I actually was an adult. And an adult when I was about 50. And I'm saying, yeah, what is this word equity? And they were saying, well, if you go to the warehouse and buy size 10 shoes, that would be equality, because everybody will have shoes. But does everybody fit them? And that is the point of equity, because some people fit different size shoes, and some people might need a higher heel because their feet their legs are longer or shorter. And so in my mind, I said, well, that's quite easy to comprehend. Then I went back to my time at school. My time at school when I started in 1964, we lived next to the goldsmiths, and one of my friends was intellectually handicapped. This is in 1964, and the principal of the day went and bought a typewriter for her to type in. I said, that's remarkable. I mean, looking back, it's remarkable. Looking back at it now, and I said, why didn't we get a typewriter? Because now we're all on the keyboard tapping away, and she can type faster than us. And it's interesting. And so at that early stage, just want to say thank you to our principal, Mr. Pax Kennedy, for buying that typewriter for our friend. And interesting also, when I became the mayor, people said, well, why I don't use the library? Why do I have to pay for the library services? I don't use the dog park. Why do I have to pay for that? And I don't use the swimming pool. And so quite bluntly we said, look, it's not about what you use. It is a tax, and it is about the equalisation of this tax to the different needs of our community. You may not have children, but our children love the swimming pool, and they love the library, and they love going there. And we spend inordinate amounts of money on those aspects, facilities for our communities. And we'll say, well, that's equality in terms of a tax that's available for everyone. But there is aspects of equity. So our disabled community, our elderly community, they are on these scooters. They travel at 50 k's an hour and run everybody down. But however, they cannot fly over the curb. And actually, New Zealand is getting very good at that. And I must acknowledge all the councils that are actually putting in these ramps at the roadside where the people can cross. I go and see my grandchildren once a month in the UK. And do you think, UK actually has these ramps? No, especially not in the suburbs. You have to lift the pram and plonk it down, and mum's in the front, and we've got to bend our back and all that sort of stuff. So the access is not that easy in a lot of places. Have you ever been to a toilet in a UK pub? It's actually downstairs somewhere, about 4, 5, 10 flights down. I don't know how the wheelchair people actually get to go to the toilet. And so as a council, we focus on those basic things, basic that we provide opportunities for everybody to actually have access into buildings, into facilities, toilets. We haven't got it right yet. After building many toilets in the Tairawhiti, we built a new one. And interestingly enough, it was right by the port, and there wasn't a toilet there before. And we said, yes, let's go and build a $1 million toilet, right? And then I went to the Tuia 250, and you know what? Old Clark was there. Jacinda's fiance was carrying Neve. He said, Meng, where's the changing pad place for our baby? And I said, it must be in the disability toilet. Well, there was nothing. I said, after all that, you know, after all these years of trying to get it right and being equitable to the needs of the babies and the young, the mums and dads in our place and our visitors, we still couldn't get it right. So there's still a lot of learning to do. Now, I'm in a room of decision makers. Is that right? Major decision makers. We all have a role. We all have a role to try and have equity at the heart of all that we do. Yesterday, I was at Waitara. Now, you wonder why Māori are in the state they are now. It's not because of their diet or anything like that. It's because of the economics and the opportunity. And in 1860, and the war raged on for 20-odd years, their land was taken. And that is the core of taking away people's economic well-being, their cultural well-being, their mana motuhake status, their rangatiratanga, more particularly their decision-making, and the opportunity of providing finance to actually go to school, go to the have good housing, to have good education opportunities, has been degraded. And, you know, we sometimes say, well, hey, look, it is their fault. No, it's not their fault. It is the fault of the Crown back those days. And if you think about inequity, it actually started at the signing of the Treaty of Waitangi in 1840. It's not a thing that is 10 years ago or 20 years ago. It is actual fact nearly 179 years ago, I think, because I think in 21 years' time it'll be 200 years of the signing of the treaty. And we've got to ask ourselves the question, 200 years' time in the signing of the treaty, which is 20 years' time, I'll be 79. I hope that I live to see that day. What would equity in your organisations look like? A challenge for each and every one of us. What would that look like in terms of opportunities, providing enough resource for those people that actually need it? Now, I pay taxes, and I have no problems in paying my taxes because I know that in our communities right throughout Aotearoa, there are needs. I do not subscribe to the social welfare benefit. I don't subscribe to the police system, and I don't subscribe to many services that the Crown actually provides. But I am happy to actually pay my taxes so that my money can go towards those people of higher need. Now, just about 10 years ago, I became one of those high need persons. I actually had psoriasis for a number of years, and now I get a embryo, a injection that I inject into my body once a week, and I'm grateful for that. And it's interesting how different. I said to my mate, mate, you need to get one of these injections because, you know, this psoriasis is debilitating. It's actually terrible. So he said, well, how do you do it? I said, make sure you keep going to the doctor, because what happens is that you will be given this drug, this drug, this drug till they all fail. And then you get this biological thing, and it creates magic. And that is the inequity of some patients, and you read about it in the health report through the Waitangi Tribunal. You actually know about it through newspaper articles, journal publications, that not everybody is actually treated in an equitable way. Now, science is a wonderful thing. So they found out that Māori people actually have a different gene in terms of treatment of gout, right? So they require a different pill. So all I just say is I encourage you from the bottom of my heart, for the sake of humanity, human rights, that everyone has the right to health. Everybody has the right to a warm home. And the interesting thing that we're sort of getting our head around it now is not an isolation of anything. You can't just focus on the body health or the physical health of people. You've got to look back at what is causing this. Sometimes it is a cold, damp home. Now, there's the warm homes process through the ECA system, where there's subsidies for councils and philanthropic organisations to actually warm up homes. And I was actually amazed that, you know, in today's life, that there are still people that have 8 kids, and their children used to go to the hospital often. When we put these people into a home that had been rehabilitated with bats and underfloor impole and double glazed windows, you know, they didn't even go to the hospital after that. That is an amazing stat. So primary health is very important. I can tell you in the Te Rāwhiti that Tūranga Health, Ngāti Porou Health, they are at the coalface, and if you're part of the primary health, you'll probably be doing the same. But I'm just saying they actually are very close to their clients. It's not about the clients coming to you because, you know, you've got to drive 2 or 3 hours from Ruatoria to somewhere to go to a medical centre, or you've got to drive at least an hour from Motu or Tiniroto to a health centre in Gisborne, or even an hour and a half. And you say, well, is that right? So what they do is actually go to the marae or go to the community hall, and they provide a bus so that it picks up everyone, and they go to that particular area, and everybody gets their eyes and ears and blood pressure and blood tests, diabetics and all that sort of stuff. And it's done wonders for those people. It actually saves public health money rather than at the ambulance at the bottom of the cliff. If we can actually spend more money and acknowledge that the money is well spent in primary health, that is going to go a long way in helping our communities becoming healthier. We know that equity is a word which is sexy now, and it should be sexy. And I just want to say, please, with all your power, with all your passion, make equity the centre of your work, your community, your families, other people's families, your organisation itself is very important in terms of the reflection of the faces of your community. People, if they can see themselves in your community, they are more likely to go and do something with their health. So nō reira whānau, great to spend my 15 minutes with you today. I'm not quite sure, am I on this afternoon to repeat my thing later on? Yes, thank you. And we all have an important role to play. I'm here to support you. If you need any support from the Human Rights Commission, we do have the Equal Opportunities person. So hopefully you all get paid evenly for what you do, because that's very important. And we know that Pacific and Māori are well below the average. And so if you are the chief executive of your organisation, please give the respect to your staff that pay equity is important. Also, we have the Disabilities Commissioner, Paula, and she's really focused on disabilities, and you've probably seen her around. And give those people the opportunity to participate in your organisation as well. There are things that you can do. I like that program in the morning, I don't know what it's called, but they do, it's on Sundays, I think, about this attitude, absolutely. And so inspiring. I'm just going to say it's so inspiring that nothing is absolutely impossible. Everything is impossible if you make application to it, and I hope that you put equity in front of you and yourself. Feel what it feels like not to have equity, because you never know what will happen to us at any one time. So nō reira, tēnā koutou, John, mō mahau e whakahaere tēnei wāhanga mā tātou, nō reira mā laulalei, talofalafa, ni hao, assalamu alaikum. I just speak five languages, and the interesting thing is that there are over 300 dialects in the whole of New Zealand. Even though there are 216 ethnicities, there are, say like for Chinese people, there are 30 dialects. Good luck to translation line. Kia ora everyone, have a great day.